So is there any reason that people may over-intervene for any reason? I mean, one is defensive practice. So you want to be safe, or the myth that you have to be safe by doing more intervention. So it's not easy to find the balance, but inexperience plays a role in that. Knowledge gap may play a role as well, and the lack of confidence. So what if I don't do this test and the baby happens to have infection? What if I miss something that is there in the blood report? And so this thought makes you do more and more. But a reasonable level of judgment is important, and experience. You gain experience as you start doing more conservative practice. So it doesn't come automatically, and you have to try your best to try reduce interventions. Think about every test. We will be discussing those as we go on as well. In some settings, you may have incentivized practice or financial reward for overdoing. Unfortunately, the hospital gets more money if you're paid by every test. The DRG-based system, or the diagnosis-based payment system, has kind of taken away this incentive for the hospital, so people don't put pressure on you to do more tests. But in the background, you have to keep that in mind. One of the reasons, one of the things we have to focus on is not to separate the mother and the baby. So bringing the baby to the NICU unnecessarily has to be avoided, where the care can be delivered safely by the mother's side. The other important aspect is not putting too much thought. So whether I really need a test at this stage, do I need it immediately, or can it wait for the next day? And some units have a hard-driven protocol. So you need to do bloods on Monday, for example, for all the babies below 2 kilos. You need to do gases every 4 hours on ventilated patients. Blood sugar monitoring continues for a long time on babies on IV fluid without reducing the frequency, and so on. So any protocol is a backup, and it's always good practice not to forget things which are important. So have a plan that is written down, that do bloods with the next cannula change, or do bloods within this period. So if you're having anything else to be done, you combine them together. So not on a particular day, but individualize according to the baby's needs.